According to the World Health Organization, there is still time to prevent the U.S. from becoming the next epicenter for coronavirus. News 4's Alexandria Adams spoke with a local doctor about what we should all be doing right now.
Health officials say this is a peak week for coronavirus cases. They are still urging us to stay at home and limit contact with people so we can try and flatten the curve.
We're expecting to see, based on where we're at in the curve, probably the most numbers right now, and that then hopefully that will fall off as we go forward.
I want America to understand.
On Monday, the U.S. Surgeon General said this week was going to get bad in the number of cases we would see. I spoke with Dr. Gil Wright. He's the Associate Medical Director for the Metro Health Department. I asked him if we would ever be at the point where we would have to decide who would receive care and who would be turned away.
We're not at that point here in Tennessee, and I don't know that we're here in the United States at that point. However, if we were to keep exponentially growing, then we could reach that point.
He says healthcare officials are hoping to see staggered patient numbers because of businesses closing their doors and social distancing.
If we have 100 people show up in an emergency room today that need to be in the hospital, that's much different than having 100 people that show up over a month that need to be hospitalized.
Unfortunately, there's no crystal ball of when we can expect the pandemic to come to an end. Dr. Wright says it's likely for us to see it stick around for weeks.
We look for them to for us to have kind of waves of 6 to 8 weeks of ongoing illness at different times throughout the pandemic, maybe as many as 3 of these waves.
So far, the state of Tennessee has seen more than 50 hospitalizations and 3 deaths related to coronavirus. In Nashville, Alexandria Adams, News 4.